So transgender, it's really defined according to the patient. So every patient has their own view, but generally speaking, it's when the patient feels that their gender identity is different from their outside appearance.
So in terms of medical care, how would that differ, transgender medical care versus general medical care?
So again, it depends on the goals of the patient. Mm-hmm. If the patient is interested in hormone therapy, the hormone therapy that's provided is at doses that are different from typical hormone therapy, and slightly, sometimes different formulations. And then there's the preventative care part of it, mm-hmm. So making sure that any preventative care services in terms of breast cancer screening, prostate cancer screening, cervical cancer screening is attended to, regardless of the gender they're expressing themselves as. So those would be the two major differences. Mm-hmm. And then there are guidelines that tell us how hormone therapy might affect their overall health. Okay. So I need to attend to that as well.
So what kind of goals do you have for the clinic?
I think really to be able to serve as many patients as I can. And I know that sounds hokey, but I feel that there are a lot of transgender patients in the veteran population that haven't been able to find the care they need, mm-hmm. and maybe have not identified to their physician, have sort of been trying to find piecemeal care and haven't really been able to do that. I really want to be able to provide sort of comprehensive one-stop care for these patients. If it's really successful, we'll need to rethink the space and rethink personnel, but right now we're just happy to be doing it. And happy that we've gotten the VA to support us.
Oftentimes, if I go in the private sector, mm-hmm. I've run into problems with doctors that are not informed as to how to treat mm-hmm. or even are knowledgeable mm-hmm. of transgender issues. So oftentimes you have to search for somebody that is knowledgeable. Yeah. Not always successful, and sometimes painful to do such a thing. Yeah. Because the rejection is not fun to deal with.
Yeah.
But knowing that we can come to a place that is familiar with our issues helps a lot.
So what would you tell potential patients about the clinic to get them to come into the clinic?
That it is worthwhile because it is a fabulous unit. All the people who work on the PAC team are amazing. Mm-hmm. They're efficient and they're welcoming. So to take a deep breath and just come on in because it's going to be taken care of. And that the way has been paved.
Do you think it's going to work?
Yes.
How?
It is. Because we have a unit here who's going to make it work.
Okay.
It's a without-fail system because you have people who are dedicated to excellence. Mm-hmm. So that in itself is going to make it work because you have people who want it to work.
I think the need is there. And the providers are going to be there. Mm-hmm. The current ones are in place, and the training for future ones will be available, I'm sure. So with all that in place, I think it will definitely work.